Crohn's disease is becoming a common word in our culture today. Many of us know loved ones or friends who have Crohn's disease. What exactly is Crohn's disease? It's an infection of the intestine or the digestive tract that can occur from the mouth all the way through to the anus. Basically breaks down the lining of that tract where open sores and lesions occur, oozing bodily fluids and sometimes bleeding. The excess fluid in the digestive tract causes lots of diarrhea, cramping, stomach pains, bleeding. But Crohn's disease is, at this point, uncurable, and they don't know what causes it. Usually the sufferers suffer in silence, for it is a humiliating disease. They don't like to broadcast it around that they have Crohn's disease. The sufferers often know where every toilet and restroom is on their walk through life, just in case that urgent attack comes. There's little control, and as time grows on, the condition only worsens to the point where surgery or medical attention is imminent. It's a humiliating disease as they walk through life in constant misery.
So when I was about 13 years old, I had some horrible stomach pains that my parents thought because I was in a car wreck that's what was causing me the pain. So they took me to doctors, and doctors couldn't find anything. And one of the doctors told my parents that it was all in my head, that I was doing it for attention, but yet the pain would get worse. I was coming home from work and immediately getting my heating pad and just going to bed. I had no appetite. I couldn't eat. The pain was just terrible. So my parents continued and took me to yet more doctors. Another doctor told them that I had a rare blood disease and didn't have long to live. And finally, I guess I was probably maybe 19. And my dad had said one day, he goes, "I've had enough. We're calling the Cleveland Clinic and we're going to get you in there and we're going to find out. We're going to get to the bottom of this." So they took me to the Cleveland Clinic and I had all kinds of tests, more than I'd ever had before. They thought it could be maybe a cyst on my ovaries, so I had gynecologists. And then they thought, no, it's not that. They did test, didn't see any cysts. Then they got me endocrinologist to check and make sure that system was functioning. Finally, when the Cleveland Clinic couldn't find anything wrong, they had done x-rays and blood tests and everything you could think of. Finally, the doctor at the Cleveland Clinic, Dr. Fazio, who was a gastroenterologist, said that they thought they should do exploratory surgery. So they set a date for me to come into the hospital, and I was going to be admitted for exploratory surgery. Probably the week before I was supposed to have this surgery, I came home from work in the most awful pain ever. I was in tears. I couldn't eat. I don't even know how I drove home that day. And I went to bed, and my dad was very upset. And he was like, "Come on, I'm taking you to emergency." So he took me down to emergency, and he told them I had a date in a week for exploratory surgery. And they said, "Well, we might as well just admit her." So they admitted me and said they would do the surgery the next day. The next day came, and this is all what my parents had told me. I had 6 doctors in the room because they didn't know what they were going to find. I had 2 endocrinologists, 2 gynecologists, and 2 gastroenterologists. Well, I guess when they opened up, they saw that I had a growth the size of a grapefruit, which had grown to my right ovary. So they scraped it off of my ovary and they removed a foot of large intestine and a foot of small intestine. And that at the time is what they called a resection. So the next thing I remembered was waking up in a room and my parents were there. And I remember I had tubes coming out of my nose, and I had a catheter, and I had tubes coming out of my side. Everywhere they could stick a tube, they put a tube, and they were just draining and draining. And I was in the hospital probably for maybe a week or two. I mean, we're talking in the 70s. This was 73, so they kept you in there a lot longer then. And the doctor told me that at that time, he said, you probably won't be able to have children. He said the weight of a pregnancy on your intestines will make your body naturally abort trying to have any children. He told me I have mitral valve prolapse, which is a leaky valve in the heart. And eventually I started to get well enough that I could get home, and I was home for many, many months. Probably, golly, I think I didn't go back to work until February of the next year. My surgery was in October of 73, and I went back to work in February of 74. And I hardly got back to work. And in June or July, I started having pain again around the middle of my body that was just felt like someone had a lasso around my chest and was pulling it tighter and tighter. And I would beg my younger sisters to give me pain medicine, and I would come home and just lay down again. Well, of course, they told my parents, and my parents once again took me back down to the Cleveland Clinic and yet another surgery. And here, this time it was for gallbladder. The doctor had said he knew it was bad, but he didn't think that I would be able to tolerate 2 major surgeries at one time. So he knew it was a ticking time bomb, was just waiting for when that would happen. And then I finally got recuperated, went back to work again, and just had to deal with the issue of retraining my body with bathroom habits. It's once you have that intestine messed with like that, and once they've cut muscles in there, it's totally different. And ever since that time, it's been nothing but diarrhea. I know it's too much information, but every day is just diarrhea. And then it got to the point not too long ago, probably 2006, is when I experienced my first blockage because I ate an apple. And that was again excruciating pain that I had never experienced. And my husband took me to the emergency room, and after doing a CT scan, they confirmed, yes, it's a blockage. They keep you in the hospital probably about a week on an IV. You have to gradually work your way back up to food, and you don't get to go home until something is moving through those intestines, and then they release you. So I went through numerous blockages between 2006 and 2010, numerous, until it finally got to the point where my husband said, we can't keep going like this. We need to get you back to the Cleveland Clinic and see what they can find, what they can do. So we went to see a surgeon at the Cleveland Clinic, colorectal, Dr. Tracy Hall. and she removed another 6 inches of small intestine in 2011. And ever since 2011, the diarrhea seems to have become more frequent than it ever was before. And I was also diagnosed with a rectovaginal fistula. And if you don't know what those are, thank your lucky stars that you don't have one, because it's not a pleasant thing. I think you can put two and two together just by the name of it. There's a connection between the rectum and the vagina. So now that complicates things even more, because every time I go to the bathroom, it not only comes out one way, it comes out both ways. And it causes me many urinary tract infections, and it's just a lot of bacteria. And so I sought a second opinion earlier in 2013, probably in May. I went to another doctor, and she confirmed the fistula, and that the only way to fix the fistula would be a colostomy or an ileostomy, but they would not attack the fistula directly, because they've learned from previous times on other patients that it doesn't work so well. And so now that's where I'm at, going through many pre-testing things. Dr. Hall said she would not touch me blindly. It's been a couple years since I've seen her. So she's sending me for numerous tests to check out the small intestine by CT enterography. And in about a month, I have a upper scope and a colonoscopy schedule. So she'll check that end as well. And then I go back to see her in November of 2013, and hopefully we'll figure out what's going on then.